How to do a research project. Module 1.1, Coming up with an idea. To review, this course will cover the major steps in conducting a research project from start to finish, which include 1. Coming up with an idea. 2. The research proposal. 3. Submission to the IRB. 4. Collecting data. 5. Analyzing data. And 6. Preparing the manuscript. The first module of this course consists of developing an idea. We are currently on submodule 1.1, Coming up with an idea. The learning objective for this module is to describe how to generate and assess the feasibility of a research project idea. The first step of coming up with an idea seems simple, but it is often where many researchers make their first mistakes that, unfortunately, can haunt them throughout their entire projects. All too often, researchers wait for inspiration to come to them, only to be left scrambling in the months before their papers or projects are due. Arguably, there are two methods of choosing a research project idea. One is to wait for the idea to come spontaneously, and the other is to strategically go about listing and eliminating ideas. Obviously, the second method will produce more reliable results. When beginning to utilize the second method to strategically list and eliminate ideas, it is best to optimize the time spent brainstorming. Pick a day in which a few uninterrupted hours can be devoted to considering the project and options. Also, pick a workplace that is quiet, such as an office, library, or private room with cell phones silenced, if possible. When continuing to brainstorm and generate ideas, the researcher should make a list of topics about which they have always been curious or have had unanswered questions. These may be topics that they have discussed with colleagues and fellow researchers or that have arisen from recent research articles that they have read. Another approach is to think of a new clinical protocol or policy that their hospital has introduced. The implementation of a new policy always creates golden opportunities for a research project and increases the likelihood that the project will receive much interest. In the following example, we will examine how systematically examining a protocol change can easily lead to a clinically relevant and answerable research question. Specifically, this example will investigate how a change in protocol for diagnosing gestational diabetes, or GDM, at a residency program in Kansas opened an opportunity for a research project. In this example, the resident obstetric clinic initially used a traditional two-step diagnostic sequence consisting of a 50-gram 1-hour glucose challenge test followed by a 3-hour 100-gram glucose tolerance test. In this sequence, only those women who failed the 1-hour test were sent for the 3-hour test. The problem with this two-step mechanism was compliance. Virtually everyone did the first step, but of those who were recommended to undergo the second step, many did not comply. Consequently, there was a tendency for the diagnosis of GDM to be delayed in these women. As a result, the clinic leaders decided to change the policy and to adopt a universal one-step, 2-hour glucose tolerance test, or GTT. One of the goals for this procedure shift was to definitively diagnose GDM and begin treatment earlier. However, one potential pitfall to this step was that patients had to be fasting when they were scheduled. For patients who presented early, this was obviously not an issue, since their 2-hour GTT could be scheduled to coincide with their 28-week visit. For patients who presented late to care, the scheduling requirements represented a significant obstacle. This scheduling issue required patients to come back on a day other than their clinic visit. Given the extra burden in terms of time and transportation, some patients either delayed their appointments because of scheduling conflicts or forgot the second appointment and did not show up at their scheduled times. In short, major protocol changes such as this one create golden opportunities for research projects. The point of this example is to show how a policy change immediately set the stage for an excellent research project, the results of which would be highly anticipated. In the case of the previous example, one potential research question could be, on average, are gestational diabetics being diagnosed at earlier gestational ages after versus before the implementation of this new protocol? Because of the policy change, areas of study were automatically created, leaving it up to the researcher to identify and pursue them. Aside from policy changes, another practical way to come up with an idea is to piggyback, or elaborate on, material from another study. One example of piggybacking is to increase data on an existing project. An example of this would be a graduating senior who has a project started but does not have enough data to complete the project as it stands. A junior resident could carry that project through to completion. A second method of piggybacking is to replicate an existing study in a new population. For example, if a fellow resident has a project that focuses exclusively on a highly specific patient population, the application of their study could be expanded to a new population. Another resident could replicate the study with a different population and assess whether there are differences between the patients with respect to the outcome of interest. A third example of piggybacking is to utilize existing data to answer a new question. A resident could be doing a chart abstraction study to answer one question, while their data could be utilized to answer or address other questions. In other words, a resident could make their study a sub-study of another resident's study. All of these strategies, combined with focused concentration, are avenues the researcher may pursue to develop an effective, pursuable research topic. Once a reasonable list of potential research topics has been generated, the next and most vital step is determining feasibility. A number of potential issues come into play in determining which projects will be more work than they are worth, or which require more than what time restraints or available populations for the study will support. One way to assess if a project is feasible is to determine if it is a retrospective or prospective study. A retrospective study primarily collects and examines data and will almost exclusively examine common factors between patients' medical histories, patients' lifestyle choices, or previous studies already performed on that particular population group. For a retrospective study, a few important questions should be considered. How many charts will need to be reviewed to achieve statistical power? How much data will be abstracted from each patient's chart? Is the outcome of interest reliably coded or recorded in the medical record? Is a publicly available dataset being used? When using publicly available datasets, which will be discussed later in this module, the institutional review board process is usually much easier, as the study will typically be exempt from full review. On the other hand, publicly available datasets are usually very large and require extensive statistical and computing power to mine through all the data to extract what is needed. Next, prospective studies usually incorporate observational studies as well as experiments and clinical trials. If a research project will be prospective, here are some vital questions to consider. How many subjects will need to be recruited to achieve statistical power? Are biological specimens being collected from the patients? Is financial compensation being offered? Overall, determining whether a study is retrospective or prospective and evaluating the needs of each type of study is an excellent method for assessing a project's feasibility. Next, we will discuss several publicly available datasets that can be utilized to generate research ideas. The first is the Healthcare Cost and Utilization Project, or HCUP. The HCUP includes the largest collection of longitudinal hospital care data in the United States. Next is the New York Statewide Planning and Research Cooperative System, or SPARCS. SPARCS is a comprehensive all-payer data reporting system established in 1979 as a result of cooperation between the healthcare industry and government. The system was initially created to collect information on discharges from hospitals. SPARCS currently collects patient-level data on patient characteristics, diagnoses and treatments, services, and charges for each hospital inpatient stay and outpatient visit, including ambulatory surgery, emergency department, and outpatient services, in addition to each ambulatory surgery and outpatient services visit to a hospital extension clinic or diagnostic and treatment center licensed to provide ambulatory surgery services. Next is the National Health and Nutrition Examination Survey, or NHANES. NHANES is a program of studies designed to assess the health and nutritional status of adults and children in the United States. The survey is unique in that it combines interviews and physical examinations. NHANES is a major program of the National Center for Health Statistics, or NCHS. NCHS is a part of the Centers for Disease Control and Prevention, or CDC, and has the responsibility for producing vital health statistics for the United States. Finally, there is the Centers for Medicare and Medicaid Services, or CMS, Timely and Effective Care Measures. This dataset includes provider-level data for care measures for heart attack, heart failure, pneumonia, surgical care, emergency departments, preventative care, and more. The next section in this course is Module 1.2, the Research Proposal. The learning objective for this module is to describe the characteristics of a successful research proposal.